Black History Month started as a way of remembering the important events and contributions of people of the African diaspora. The precursor of this celebration began in 1926 when Dr. Carter G. Woodson and the Association for the Study of Negro Life and History proclaimed the second week of February to be Negro History Week. Woodson chose this week because it coincided with the birthday of Abraham Lincoln on February 12th and that of Frederick Douglass on February 14th. Black History Month reminds the world of the significant contributions made to this nation by people of the African diaspora. It also provides an opportunity to celebrate diversity by reminding us that we all have something to contribute. Throughout history, African Americans have taken enormous risks for the sake of racial equality to better the lives of all by providing an opportunity for different cultures and backgrounds to understand better how we are all connected. Black History Month offers an opportunity for all of us to become acquainted with a history not found in the history books of this nation, an account that we must never forget as Black Americans, because if we were to forget, we would never appreciate the blessings we enjoy today. I invite you to celebrate with us not only Black history, but our history, because Black history belongs to all of us.
Hi, I'm Kevin Slavin, President and CEO of St. Joseph's Health. In 1976, President Gerald Ford officially recognized Black History Month, calling upon the public to seize the opportunity to honor the too often neglected accomplishments of Black Americans. Today, Black History Month is one of the most widely recognized events of cultural heritage around the world. And every February, we remember and recognize people of color who have pushed boundaries, broken down barriers, and influenced the building of our nation, including the evolution of healthcare. This year, 2022, the theme for Black History Month is Black Health and Wellness. And this year, we want to make Black History Month more than just a time to celebrate the rich culture and incredible contributions of Black people throughout history. In keeping with the theme, we also want to act on addressing long-standing inequities in healthcare access that disproportionately affect Black people and people of color. For many Americans, decisions around health and wellness are based upon personal preferences, looking for what fits their schedule and routine. For Black people, however, choices around health and wellness are quite literally life and death. Long-standing health disparities have been on glaring display during this recent coronavirus pandemic, leaving Black people particularly vulnerable. Recent data shows the rate of death for Black Americans from COVID-19 is 2.5 times higher than white people. This is largely due to the social determinants of health that many Black families face, including access to healthcare services and early medical interventions. Now more than ever, the pandemic has deepened the discussion on racism as a public health crisis. Our mission at St. Joseph's is to improve the health of the African American community by serving as a trusted partner, enabling and assisting African Americans in navigating the healthcare system so they too can receive quality healthcare regardless of their circumstances. This year, St. Joseph's is launching a comprehensive effort to focus more intentionally on health equity. This commitment will enable us to be a health system for all, devoted to bringing health, hope, and healing to every corner of the communities we proudly serve. On behalf of everyone here at St. Joseph's Health, we invite you to celebrate Black History Month with us as we affirm and strengthen our commitment to eliminating health disparities for all.
Max Planck, a winner of the Nobel Peace Prize in 1918, made a profound statement, and I quote, "When you change the way you look at things, the thing you look at changes." In 2022, we must change our perception. We have preconceived notions of how things are, were, and will be. but we must alter our thinking and see things not as they were, but how they should be. With crime on the rise and a pandemic in front of us, we must look beyond what we see and make things happen. As a nation of people that have been oppressed, depressed, and suppressed, in order to get to our next, we must rise above it all. We must change our perception. I am who I say I am. If it wasn't for our forefathers to change their perception, to see themselves free and liberated, we would still be bound. I'm reminded of a story in the Bible where Jesus was in a city called Bethsaida, and there was a blind man in the city. And when Jesus arose and saw the man, he immediately took him from the city and let him out. There he took the blind man and began to spit in his eyes. And he put his hand on him. And he asked the man, "What do you see?" And the man replied, "I see men walking around like trees." For the second time, Jesus put his hand on his eyes and asked, "What do you see?" And the man replied, "That I can see clearly now." So what is the moral of the story? First, sometimes we must remove ourselves from our current situation to see things in a different perspective. Second, it takes some dirty things in our lives to move us to the road of recovery and restitution. It may not be spit, but poverty, police brutality, diseases, and low income may be nasty now. But once you've gone through the heartaches, the disappointment, and the shame, you can begin to see clearly now. We need to open our eyes and see what has been revealed to us for us to have a change of perception. I am not what society says I am. I am not defeated, but I am fearfully and wonderfully made. I am not a preconceived notion, but I have been conceived with a notion, a purpose, and a destiny. Amazing grace, how sweet the sound that saved a wretch like me. I was lost.
The cry for oneness continues to echo throughout the nation. Oneness that reflects equality in the manner we value, respect, treat, and love each other. The sacred book recorded a prayer in the Gospel of John 17, that they all may be one. Dr. Martin Luther King had longed for the day when children of all races would hold hands and play. Bob Marley sang of a day when the color of a person's skin is as no more significance than the color of their eyes. Churches still sing, "Bind us together, Lord, with cords of love that cannot be broken." The nonviolence movement, championed by Dr. King, has given way to an enormous amount of change in our nation. But there is work yet to do. In emulating Dr. King, may our contribution for equality be intentional, impactful, sacrificial, and lasting. In reflecting, we cannot overstate the spiritual connectedness of those who have gone before us. We must stay encouraged, taking time to acknowledge and celebrate the accomplishments and growth of our Black brothers and sisters thus far. It is notable at SJHMC that we are diverse in language, gender, religion, education, color, and status. However, we are functional as a team, upheld and united by respect and love for each other. I hear the familiar sacred scripture text, 1 Corinthians 13:13, "And now abideth faith, hope, love, these three, but the greatest of these is love." May we exercise our faith in prayer for further growth. May we continue in hope that our tomorrows will be brighter. And may we take every opportunity to share our love.
Hello, my name is Ayden Shannon, and this is a quote from Harriet Tubman. "Every great dream begins with a dreamer. Always remember you have within you the strength, the patience, and the passion to reach for the stars and to change the world."
Thank you for joining us. I would like to thank all of those who assisted greatly in putting this program together in celebration of Black History Month. Also, I would like to thank our speakers today, and we are especially grateful to our guest speakers. I want to extend a very special thanks to Ayden Shannon, who did a beautiful job reading one of the most famous quotes in African American history. So I've had the privilege of working closely with the African American Affinity Group for the last 5 years. It has been a wonderful experience and a true delight to work with this group. When I think of the affinity groups, and specifically the African American Affinity Group, I think of our core value of dignity. This particular affinity group goes to great lengths to educate us on the African American experience and how that shapes the delivery of health care. They recognize the importance of spirituality and music to the lives of African Americans. The core value of dignity is very much reflected in the events that are being planned for Black History Month. The African American Affinity Group will be providing some education about several Black authors and African American movies. There will be posters displayed around the organization featuring some of the most prominent African Americans in our history. Also, these special recognitions and educational facts from African American history can be found on the Employee Inside page in the upcoming weeks. And of course, Black History Month wouldn't be complete without featuring African American cuisine. Throughout the month, the cafeteria will be offering different varieties of soul food. Please stop by and enjoy. In closing, I'd like to say that in spite of the pandemic, I believe the African American Affinity Group has done a wonderful job at offering many educational opportunities for us to enjoy during Black History Month. I invite all of you to join the African American Affinity Group in celebrating this special month. Thank you.